Let me begin with a question that often makes people uncomfortable but shouldn't. Why do we stop talking about sexual health the moment people grow older? Desire does not disappear with age. What does change is the body, and that's where understanding becomes essential. As a doctor, I don't warn seniors to stop living, I warn them to live wisely. If you are 70 or 80 and still masturbate, here are 8 key points you should understand for your health, safety, and peace of mind. Masturbation is not inherently harmful. And this is one of the most important truths older adults deserve to hear clearly and without embarrassment. There is no medical age limit on sexual desire, and the body does not suddenly become unsafe or wrong simply because someone enters their 70s or 80s. From a clinical perspective, masturbation is a normal physiological response connected to hormones, circulation, and the nervous system, all of which continue to function throughout life. In fact, for many older adults, it can be a safe way to maintain awareness of their body, reduce stress, and experience comfort or relaxation. Problems do not arise from the act itself, but from ignoring overall health conditions that may accompany aging. As the body changes, factors such as heart health, joint strength, balance, medication side effects, and skin sensitivity become more relevant. When these are respected, masturbation remains generally safe. What often causes harm is not the behavior, but the shame surrounding it. Many seniors were raised in generations where sexuality was rarely discussed openly, leading to unnecessary guilt or secrecy that can negatively affect mental and emotional well-being. Chronic shame has been linked to anxiety, depression, and social withdrawal, which are far more dangerous than the behavior being judged from a doctor's standpoint. Healthy aging includes understanding and accepting the body rather than suppressing natural functions out of fear or misinformation. Masturbation does not weaken the body, drain energy reserves, or shorten life. Instead, awareness, moderation, and listening to physical signals are what truly matter. If discomfort, pain, dizziness, or distress occurs, that is a medical issue worth discussing just like any other health concern. Aging with dignity means replacing myths with knowledge and fear with informed self-care. Heart health becomes increasingly important as we age, and this is especially true when it comes to any activity that raises the heart rate, including sexual arousal. As the body gets older, the heart and blood vessels may not respond as efficiently as they once did. Conditions such as coronary artery disease, high blood pressure, irregular heart rhythms, or a history of heart attacks are more common in people in their 70s and 80s. During sexual stimulation, the heart beats faster and blood pressure temporarily increases, which is usually harmless for healthy individuals but can place additional strain on a compromised cardiovascular system. This does not mean that older adults must avoid sexual activity or masturbation altogether, but it does mean they should be aware of their limits. Ignoring warning signs such as chest pain, shortness of breath, dizziness, or unusual fatigue can be dangerous. Many seniors also take medications for heart conditions, including beta blockers, blood thinners, or blood pressure drugs, which can affect circulation, stamina, and balance. These medications may increase the risk of lightheadedness or falls. If the body is pushed too hard, a doctor's advice in this area is not meant to shame or restrict pleasure, but to prevent serious complications. Just as physicians recommend pacing physical exercise according to heart health, sexual activity should be approached with the same awareness, paying attention to breathing, avoiding strain, and stopping immediately if discomfort appears. Simple but vital precautions, good heart care through regular checkups, medication management, and honest conversations with healthcare providers allows older adults to continue enjoying life safely. When heart health comes first, fear is replaced with confidence, and pleasure does not have to come at the expense of well-being. As people grow older, medications often become a regular part of daily life, and this is an important factor to consider, because medications can significantly change how the body responds to sexual stimulation. Many adults in their 70s and 80s take prescriptions for blood pressure, heart disease, diabetes, depression, prostate conditions, pain, or sleep. While these medications are essential for managing health, they can also affect circulation, nerve sensitivity, balance, and energy levels. For example, blood pressure medications and beta blockers may reduce blood flow or cause dizziness, which can make arousal feel different than it once did. Antidepressants are known to alter libido, sensation, or the ability to reach orgasm, sometimes leading to frustration or confusion. Blood thinners increase the risk of bruising or minor bleeding if the skin is irritated, which matters more as aging skin becomes thinner and more fragile. Pain medications and sedatives may dull sensation or impair coordination, increasing the risk of muscle strain or loss of balance. These changes are not a sign that something is wrong with the person, but rather a predictable interaction between medication and the aging body. The danger comes from not recognizing these effects and pushing the body beyond what it can comfortably handle. Seniors may mistakenly blame themselves or feel embarrassed, rather than understanding that medication side effects are common and manageable. From a medical standpoint, awareness is key. Adjusting timing, pace, or physical positioning can often reduce discomfort or risk. In some cases, a doctor may be able to adjust dosage or recommend alternatives if side effects are interfering with quality of life. Honest communication with healthcare providers is essential, and there is no medical reason to avoid discussing sexual health concerns. Medications are meant to support well-being, not diminish it. Understanding how they affect the body allows older adults to make safer, more confident choices and continue caring for themselves with dignity and self-respect. As the body ages, physical strain becomes a more meaningful concern. And this is not about fear but realism. Muscles naturally lose strength and flexibility over time. Joints may become stiff or arthritic, and balance can be less reliable than it once was. Movements that were effortless decades ago may now place unexpected stress on the lower back, hips, knees, shoulders, or neck. During sexual arousal, the body tenses, breathing patterns change, and muscles may contract repeatedly, which can increase the risk of cramps, strains, or lingering soreness if the body is pushed beyond its limits. For older adults, even a brief moment of awkward positioning can lead to muscle pulls or joint pain that lasts for days. Balance is another important factor. Seniors are more vulnerable to falls and a loss of balance even from standing up to quickly or shifting position can result in serious injury. These risks are not a reason to avoid sexual expression, but they are a reason to slow down and listen carefully to the body. Pain, stiffness, or weakness are not signs of failure. They are signals asking for adjustment. Taking time, choosing comfortable positions, and avoiding sudden or forceful movements can significantly reduce risk. Stretching gently beforehand and ensuring a safe, stable environment can also make a difference. Ignoring discomfort out of habit or pride can lead to preventable injuries that interfere with overall mobility and independence. From a medical perspective, protecting physical health is part of aging well. The goal is not to eliminate pleasure, but to preserve strength, safety, and quality of life. Respecting physical limits allows older adults to care for their bodies with wisdom rather than regret, ensuring that comfort and well-being remain priorities at every stage of life. Emotional health is just as important as physical health, yet it is often overlooked. Many people focus on eating right, exercising, and visiting the doctor regularly, but neglect the state of their mind and emotions. Emotional well-being affects every part of our lives, influencing how we think, feel, and act. When our emotions are out of balance, it can lead to stress, anxiety, depression, and even physical illnesses like heart problems, high blood pressure, or weakened immunity. On the other hand, a healthy emotional state can improve resilience, relationships, and overall quality of life. Taking care of emotional health means recognizing and accepting your feelings rather than ignoring or suppressing them. It involves developing healthy coping mechanisms to deal with stress and challenges, such as practicing mindfulness, journaling, or seeking support from friends, family, or professionals. Emotional health also depends on the connections we build with others. Strong relationships provide comfort, reduce stress, and give a sense of belonging, all of which are essential for a balanced life. Ignoring emotional health can have serious consequences. Chronic stress, unresolved trauma, or prolonged sadness can affect sleep, energy levels, and even decision-making abilities. Conversely, investing in emotional well-being can enhance creativity, focus, and motivation, allowing people to achieve their personal and professional goals more effectively. Society often praises physical strength or appearance, but true health comes from harmony between the mind and body. Just as we schedule medical checkups or workouts, we should also make time to reflect, relax, and nurture our emotional self in the long run. Prioritizing emotional health is not a luxury, it is a necessity. By valuing and caring for our emotional well-being, we lay the foundation for a happier, healthier, and more fulfilling life. Emotional health is not separate from physical health. It is an integral part of it, deserving equal attention and care. Sleep and energy levels are closely connected, yet many people underestimate just how much one affects the other. When sleep is disrupted or insufficient, it directly impacts the body's ability to function properly, leaving a person feeling drained, irritable, or unfocused during the day. Quality sleep is not just about the number of hours spent in bed, it is about reaching the deep stages of rest that allow the body to repair itself, regulate hormones, and consolidate memories. Without this restorative sleep, energy levels drop, making everyday tasks feel more exhausting and reducing overall productivity. Several factors can interfere with sleep and, consequently, energy levels. Stress, anxiety, poor diet, irregular schedules, and excessive screen time before bed all disrupt the natural sleep cycle. Even mild disturbances, such as waking up frequently or struggling to fall asleep, can accumulate over time and lead to chronic fatigue. When energy levels are consistently low, it can affect not only physical performance, but also mental clarity, emotional stability, and motivation. People may find themselves relying on caffeine or sugar to get through the day, which provides only temporary relief and often worsens the problem by further disrupting sleep. Maintaining proper sleep hygiene is essential for sustaining energy. This includes setting a consistent sleep schedule, creating a calm and dark sleep environment, limiting stimulants in the evening, and incorporating relaxation practices like meditation or deep breathing before bed. Paying attention to both the quantity and quality of sleep allows the body to recharge efficiently, supporting physical health, mental sharpness, and emotional balance. Energy is the fuel that drives daily life, and without adequate sleep, even the simplest tasks can feel overwhelming. Prioritizing sleep is not a luxury, but a vital necessity. By valuing rest as much as activity, we can maintain high energy levels, improve performance, and enhance overall well-being in a sustainable way. Skin and personal hygiene are essential aspects of overall health, yet they often require extra attention as we age. The skin is the body's largest organ, acting as a protective barrier against infection, environmental pollutants, and physical injury. Over time, it naturally becomes thinner, less elastic, and more prone to dryness, irritation, or damage. This makes regular care not just a matter of appearance, but a crucial part of maintaining health and preventing infections. Simple practices, such as daily cleansing, moisturizing, and protecting the skin from harsh sunlight, can make a significant difference in how healthy and resilient it remains. Hygiene goes hand in hand with skin care. As the body ages, sweat and oil glands may produce less moisture, making it easier for bacteria or fungi to thrive if cleanliness is neglected. Daily routines like washing hands, bathing regularly, brushing teeth, and keeping nails trimmed are critical for preventing infections and unpleasant odors. Older adults are more susceptible to skin conditions such as rashes, fungal infections, and pressure sores, which can escalate quickly if hygiene is overlooked. Regular attention to hygiene also helps maintain dignity, boosts confidence, and fosters social connections, which are important for emotional well-being. Another important aspect is the choice of products. Using gentle, pH-balanced cleansers and moisturizers can help maintain skin's natural barrier. Avoiding harsh soaps or excessive scrubbing prevents further irritation. Sun protection, even indoors or during short outdoor exposures, protects against skin cancer and premature aging. Additionally, staying hydrated and consuming a balanced diet rich in vitamins and minerals supports the skin from within. Ultimately, skin and hygiene care are ongoing responsibilities that require mindfulness and consistency. Paying attention to these details is not superficial, it is a vital part of maintaining health, comfort, and quality of life when skin and hygiene are prioritized. It not only prevents illness, but also promotes confidence, self-respect, and a sense of well-being. That carries into every aspect of daily life. Pain or discomfort is a signal from the body, not something to be dismissed as normal. Many people, especially as they age, assume that aches, stiffness, or persistent discomfort are simply part of getting older and something they must endure. This mindset can be dangerous because it often prevents individuals from seeking the care they need. Pain is the body's way of alerting us that something is wrong, whether it is an injury, inflammation, or an underlying medical condition. Ignoring it can allow minor issues to develop into more serious problems that may be harder to treat later. Chronic pain can affect not only physical health, but also emotional well-being. Persistent discomfort can lead to fatigue, irritability, anxiety, and depression, creating a cycle where emotional distress worsens the perception of pain. It can interfere with sleep, reduce mobility, and limit the ability to engage in activities that bring joy and maintain fitness. Because of this, addressing pain promptly is essential for both quality of life and overall health. Proper evaluation is key. Consulting a doctor or specialist ensures that pain is not a symptom of a more serious condition, such as arthritis, nerve damage, or cardiovascular issues. Treatment may include medication, physical therapy, lifestyle adjustments, or targeted exercises designed to relieve discomfort and strengthen the affected area. Early intervention often leads to faster recovery, improved mobility, and better long-term outcomes. It's also important to listen to your body and distinguish between temporary soreness from exertion and the ongoing discomfort that persists or worsens over time. Pain should never be ignored or normalized. It deserves attention and care. By acknowledging and addressing it, you protect your body, maintain independence, and prevent complications that could significantly impact daily life. Taking pain seriously is not a sign of weakness, it is a proactive step toward health, comfort, and longevity. Your body communicates for a reason, and responding appropriately is crucial at any age.